Hi everyone, I'm Dr. Yuzilak and this is our fourth annual back to school video. This school year and this season is going to be an interesting one. With any kind of cough, flu-like symptoms, fever, we're going to be wondering, is it just a regular virus of the season or is it COVID? In about 2-3 weeks, we should be getting a rapid COVID test, meaning we'll be able to test everybody and see if they're positive or negative, have results in about 20-30 minutes. And the best part about this test is that it will be available to anyone regardless of their age or if they have insurance or not. Before we dive in, please do not forget about the importance of the healthy diet. Try to reduce the pro-inflammatory foods such as sugars and processed foods. Support your lymphatic drainage by taking hot and cold shower or just a cold shower. Try to regulate your bowel movements. Having them daily is the best. Take an Epsom salt bath to relax and absorb magnesium. Sleep better. Try to meditate, breathe, maybe do yoga, exercise, or simply keep moving. Today I will talk to you about the supplements. First, I'm going to be talking about preventive measures, how to boost your immune system for the upcoming season. And then secondly, I'm going to talk about what to do as a first-line therapy, what to take with the first symptoms of the viral illness. Everything I mentioned today you can find online at our Green Pharmacy, and there you can read more about the brand, ingredients, etc. And if you currently use some other supplements and wonder if they're good quality, you can always bring them to the office at your next visit and I can check that for you. Well, my top favorite 2020 preventive supplements are vitamin D, vitamin C, zinc, selenium, liposomal glutathione, elderberry syrup, and for those of you who like the essential oils, I would recommend for this season cypress oil. Vitamin D, you know, is based by the weight in kids, and then there's a whole post on our Facebook page about how to dose vitamin D. You have it in the liquid form, and you have it also in the capsules for the adults, which is then once a week dose. Then there's your vitamin C. This is absolutely my favorite one by Metagenics, but also there are options for tablets. They're a little bit smaller in size, and the powder that you can dilute in some water or one of your favorite drinks and have it that way. And then there's zinc. So the cool test that you can take at home to decide if you really do need the zinc or not is to actually take one capsule, dilute it in a little bit of water and drink it. And if you feel a metallic taste in your mouth, that most likely means that you have enough of the zinc. And if you don't, if you just feel the taste of the water, then you need more zinc. Also, some of the COVID patients reported loss of smell and loss of taste, and that might be actually related to the underlying zinc deficiency. If you are our patient, you're by now absolutely a pro in taking all these three. The new thing that I'm going to mention today is the selenium supplement. Studies suggest that it might actually stop virus from entering into the healthy cell. And so you can check the references below, which means that it might lower the infection rate from viral illness. I know you're gonna ask how much to take, so usually I suggest for this liquid version 1 to 2 drops every single day. Another cool new supplement for this particular season is the glutathione. I like the glutathione liposomal gel because it delivers 100 milligrams in just 2 pumps of the gel. It does have a little bit of the pepperminty lemony taste, and you have to keep it refrigerated. Glutathione levels normally do get lower after the age of 65, also in male, in smokers, people who suffer from chronic illness, people who don't eat enough of the fresh vegetables. Also, certain fever reducers might lower our glutathione storages, and it's actually even essential in synthesis of the vitamin D. And so this summer, I already started checking the levels of the vitamin D and glutathione, especially in my high-risk patients, since there is reported higher morbidity and also mortality in the patients with low vitamin D and low glutathione. You can ask your healthcare provider if they want to check those levels for you, if they feel that you need it. That gets us to the elderberry syrup. The Elder Power by Sundance Botanical. This is the legendary syrup that we've been using since the first post about back to school, so you know everything about it. Elderberry syrup and cytokine storm. Please do not panic about it. We discussed that before. It's good stuff. You can use it. And then we get to number 7 for the lovers of the essential oil, cypress oil. Diffusing the cypress oil at night can actually boost the production and activity of the NK cells, which are the natural killer cells, and also the T cells. They are the soldiers that recognize and kill the virus infected cells, and then they also recruit new soldiers or new army to fight the infection. So this particular oil that we have in our pharmacy is called Breathe Easy, and it's a combination of various essential oils. If you just want to get a cypress oil, then you can find it online. This gets us to the second part of the talk, which is what do we do when we start getting sick? First symptoms, we grab oscillococcinum right away. Then we can use the nasal spray for the nose and throat, Argentum 23, which is the BioSilver spray. The homeopathic medicine I like using in the flu season is the Arsenicum album because it helps with respiratory symptoms. It relieves also the gastrointestinal symptoms and helps with, for example, ear infections. And lastly, Umca syrup or V-Clear. No season can go without that one because it really helps to support also our respiratory system. And that's it for today. I hope you enjoyed it and thank you for listening. I will be back shortly with another back to school video. It's just gonna be some tips about e-learning for the parents, how you can help your child do better. Thank you so much and bye-bye.